Actually, we finished the trigeminal, which is the first of the mixed cranium. Just remind me so that we follow, we discuss the facial nerve based on what we already know about the trigeminal. What do you remember about the trigeminal?
It has 4 nuclei. Three of them are sensory, one of them is motor.
Because it is mainly sensory. Okay. With a large sensory root and a smaller motor root. Okay. What are these?
We have the mesencery, the mesencephalic, and the mesencery, mesencephalic, and spinal trigeminal.
And the spinal trigeminal, which is a very long one, continuous with the gelatinous of the spinal. See that? Continuous. What is so unique about the mesencephalic one? Why is it unique? Why is it a different?
لأنه it sends collaterals to the motor nuclei.
Okay, all nuclei might send collaterals, but it's different in another way, or in 2 different ways. Mesencephalic nucleus. It has not. It has pseudo-unipolar neurons. And pseudo-unipolar neurons, we are used to finding them in where in ganglia, not in nuclei. Yeah, the ganglia of the dorsal root, ganglia, and the ganglia of these mixed cranial. But this mesencephalic is found inside. It's a nucleus with pseudo-unipolar neurons. And in fact, the pseudo-unipolar neurons connect to the sense organ directly. And what do they bring to the central nervous system? What sort of modality? Sensory modality. Are you studying? You know proprioception? Yes. And this is why they accompany, although they are sensory fibers, they accompany the motor root. Because the motor root is traveling to the muscles. So they accompany the motor roots to the muscles, and they are sensory. So they are different in many ways. Anyhow, it has got a motor nucleus and a number of sensory nuclei. What can you tell me about the motor nucleus? Where is it in the functional columns of the brain stem? Where? Is it on the inside or next to it or in the column next to that?
Special visceral efferent.
Special visceral efferent. Mumtaz. What other nerves have special efferent nuclei other than this trigeminal nucleus?
And the accessory interest to the soft palate and laryngopharynx.
Okay, and then? Yes, thank you. What are the special muscles of the face? I will start. Muscles of mastication. Okay, and then?
Muscles of facial expression.
Therefore, the third nucleus is the motor nucleus of the face. And then you said the accessory with the accessory and vagus, they come from the nucleus and vagus and so on. So these are the 3 nuclei in this column, this very special column, because it is a special visceral column. Although the muscles are striated and are attached to skeletal elements, they are visceral. But they are special because they develop from branchial arteries. Anyhow, I just wanted to link this with and review these issues. No pointer? No problem. We use this. So, as usual, we done the introduction trigeminal, now we will do the facial. The facial nerve, like the others, have a number of components. It will be different from the trigeminal because it has got more components and those more functional components. So the facial nerve, both motor and sensory lies the trigeminal, but the trigeminal is motor to special visceral muscles, while the facial we will see. Also special visceral muscles. It has got 3 nuclei, and the trigeminal has got 4. Now, the main one is motor. So it is different from trigeminal because the trigeminal is mainly sensory. The trigeminal is the sensation of the face, while the facial is the motor function of the face. So it is mainly motor, and it is found also, we just mentioned that, in the special visceral column of the lower pons. Now, it has got another motor one. And by the way, when we say motor, what do they do? What do they do in the body? This motor nuclei, what do they do in the body? The term motor, it means they stimulate what?
Muscle contraction.
Muscles,
Contraction.
yes, and you have not thought about it, but it's a motor function. Glands to secrete. So when we say it is, you say, if you look at the statement, if you look at the statement, it is a parasympathetic nuclei. It is called the superior salivatory and the lacrimal. And this motor, in what sense? They stimulate glands to secrete. And this is found medial to the motor. Why medial? Because near the center are the somatic motor. Next to them are these parasympathetic nuclei. We mentioned one of them earlier, the Edinger-Westphal of the oculomotor nerve. So this nucleus is medial to the motor because it's in the medial to it. The motor is in the special visceral. This is medial to it. And then we have the sensory nucleus. Now, the sensory sensation of the nucleus of the tractus solitarius. What source of sensation? Nucleus of the tractus solitarius. We mentioned this and we will mention it again and again until it is fixed. What sort of sensation is served?
Taste.
Touch, pain, no? Touch, pain, stress, pressure.
Okay, can you repeat the question?
What are the sensory modalities served by the nucleus of the tractus solitarius? It is greenish in color in that column, in the column, and it is the only nucleus in that column. And actually, it is not one column, it is 2 columns in the same nucleus. The general visceral afferent and the special visceral afferent. It serves all visceral sensation. Any nerve carrying visceral sensation will go to that nucleus because it serves general and special visceral sensation. But which nerves do this? If you exclude the trigeminal from the mixed cranial nerve, all three we are going to discuss today are actually linked to this nucleus because they carry fibers that serve visceral sensation, whether it is general or special. خلاص؟ فإذا عندنا this is the third one, which is the nucleus of the tractus solitarius. But also it has a link with the spinal trigeminal, and I already mentioned that with the trigeminal. General somatic sensation is served by the spinal trigeminal nucleus for the trigeminal nerve, but also for the other 3 mixed cranial nerves. all mixed cranial nerve, general somatic afferent or general somatic sensation are served by one nucleus, the spinal trigeminal. So, we're done with the trigeminal, we said it has got general somatic, then now the facial is also with the spinal trigeminal nucleus, and when we mentioned the glossopharyngeal and the vagus, also they have connection with this spinal trigeminal nucleus. Okay, these are the three nuclei of the facial. Where are they? And I will step aside. قلنا three. عندنا واحدة, one of them is the facial motor nucleus. Where? احنا ما خلصنا من دي. اللي هي بتاعت الراجمة. 8. This is the facial motor nucleus. Okay, قلنا medial to it is the parasympathetic. اللي هي اسمها superior salivatory nucleus and lacrimal together. الاثنين one nucleus. When the fibers go, or actually when the fibers accompany the facial nerve, then they go to the two different ganglia. Because these are sympathetic, parasympathetic, and parasympathetic fibers emerging from the brainstem are preganglionic fibers. Are you aware of this term? Preganglionic. You studied the autonomic nervous system? Yes. Yes. So what is preganglionic neuron or preganglionic fiber?
We can consider.
Before the ganglia.
We can consider them.
In other words, they need a third order neuron in a ganglion outside, and then from the ganglion they connect with the target organ. Unlike spinal and unlike the somatic. The somatic from the second order neuron directly to the muscle. But for autonomic, they need a ganglion. And they told you the story about the ganglia. The ganglia of the sympathetic are near the spinal cord, while the ganglia of the parasympathetic are near the organ or inside the organ, all those differences. So these fibers these are the preganglionic parasympathetic fibers in this superior salivatory lacrimal. Because when they go out, they need two different ganglia to synapse in, and from there they reach the target organ. Where is the third one? Or the third and fourth? I don't know. This green one, which is the nucleus of the tractus solitarius.
Can you repeat the nucleus again? The names of the three nuclei.
This is the facial motor nucleus. Medial to it is the superior salivatory nucleus / lacrimal, and then the nucleus of the tractus solitarius. This is for general and special visceral sensation.
What about the spinal trigeminal?
And then we have the spinal trigeminal nucleus, which serves the trigeminal nerve, the facial nerve, the glossopharyngeal, and the vagus. Somatic sensation. It means the facial nerve is very special because it has got motor, which is special somatic, and it has got motor, which is special general visceral because it supplies glands. And then we have special and general visceral afferent, and we have general somatic afferent. And two motor and two sensory nuclei. Two motor and two. And the two motor, one visceral, one somatic, one visceral, one somatic. واضح دي? It is the only nerve with this not the only, because also the glossopharyngeal and vagus are similar. The facial has got many functional components in it. These are the nuclei. This take us back. Huh? Any issue before we proceed?
Yeah, yes. Regarding the, you mentioned it's clear, cell and lactal. They are general visceral.
Okay.
So you mentioned something about the preganglionic parasympathetic. Does this mean that these nuclei are like made of or are considered preganglionic parasympathetic and then they
Not considered, they are.
They are. Okay.
This gray column, كل الكلام ده ينطبق على all these gray nuclei. They are all preganglionic parasympathetic nuclei. Okay. Plus, pointing at them. Why is it not moving? Which is this one? Okay, because there are no slides. Now, if you go back to the main motor nucleus for the muscles of facial expression. Just a link with functional anatomy. Do you think facial expression is important?
Yes.
How important?
How will you know what is how you're feeling?
Huh?
That's the other person how you're feeling. You know, we say that verbal is like 80% of our conversation.
No,
Yes,
is much less than that.
Displays emotions. Emotions are displayed through facial.
And why emotions are important?
Makes us human.
Huh?
It's a form of communication.
It's very important for social interaction. It's a form of communication.
And for survival.
Or for survival, because you need to more for social interaction. Now, you mentioned something about, you mean your expression of emotions or the other person's expression of emotions?
Both ways.
And people who know how to deal with both, they know how to understand the emotions of others, and they know how to control the expression of their own emotions. What do we call such people? Emotionally intelligent. These people are emotionally. You know how to read emotions, and you know how to control, how to express, and actually you use the expression of the emotions, because as she said, it is part of the non-verbal communication. Verbal communication is 35%. 65 is non-verbal. Now this 65% is divided into two. There is body language and there is paralanguage. Body language and paralanguage. Body language is gestures, moving your body, and facial expression. So body language is a very big part of communication. That's very important for social interaction and expression of emotion. So this main motor sends efferent fibers or efferents to the muscles of facial expression, and now we know why facial expression is important. Now, this is a motor nucleus. It receives very unique. The facial nerve is very unique. It has got a motor nucleus. The upper half of the motor nucleus receives fibers from, I will tell you now, and the lower half from different places. Not a different place, but differently. You see, it receives corticonuclear fibers from the motor cortex. When we say the motor cortex, where? In the motor cortex. The primary cortex. Now, part of the nucleus supplying muscles of upper face from both sides. Yeah, the part of the nucleus that supply the upper face bilateral, while the part of the nucleus supplying the lower face only from the contralateral. So you see, different. The part of the lower face from opposite side, from contralateral cortex. Why is it important? In lesions. You would like to know whether the lesion is affecting if it is nuclear or it is peripheral. Now, the fibers hook around, there is abducent nucleus, if you remember it, and we said the nucleus lies beneath the facial colliculus. And then we said later on we'll tell you about this facial colliculus because the fibers of the facial motor nucleus hook around the abducent nucleus, elevating the floor of the fourth ventricle. When you look at the fourth ventricle, you will find an elevation, and the elevation is caused by the fibers of the facial, the motor fibers, hooking around the abducent nucleus. Now, this is bulging the floor of the fourth ventricle as the facial colliculus.
That's one.
Yeah, this one.
It's lateral.
Huh?
The parasympathetic nuclei is lateral.
This is not accurate. This is not an accurate diagram. See, I always keep telling you this because don't believe everything you see you find on the internet or on books. Many of them are not quite accurate in their illustration and depictions. Okay, this is we are done. This is just to show you the different fibers. Now, this bump in the floor of the first ventricle is the facial colliculus, and now you know what the facial colliculus is. This is the facial colliculus. Now, the second nucleus is the parasympathetic nucleus. What is the name of the nucleus?
Superior salivary.
Superior salivary plus lacrimal or just superior salivary? Yes? Meeting 10 minutes. You want to upgrade? After 10 minutes, you can restart. Huh? Okay. Then, this is what? The superior salivary nucleus together with the lacrimal. Now, it is salivary. Remember when we discussed the hypothalamus, we said the hypothalamus is very much related to survival, eating and drinking and reproduction and all of those issues. So it sends fibers to the superior salivary nucleus because it controls the gastrointestinal function through these nerves or the nuclei of these nerves. Now, taste goes through the nucleus of the tractus solitarius, we mentioned that, which is special sensation, isn't it? Taste is one of the special sensations. Now, the lacrimal one, the lacrimal part of the superior salivary receives afferents from the hypothalamus for emotional response. What do we mean by emotional response? You know, if you have an exam or somebody dies, hypothalamus, very much related to the limbic system, of course. Then through these lacrimal glands, then you start crying. Now, afferents to the lacrimal. I mentioned before, we have afferents to motor nuclei to communicate what is happening. So afferents to lacrimal are from the trigeminal nucleus for reflex lacrimal. Reflex lacrimal, when you touch cornea, this will go directly to this lacrimal part of the superior salivary. So you have reflex lacrimation because it's important. It's not just a touch. When dust goes into your eye, you need to clean it up, or when there is infection. So this is called reflex lacrimation. How does it happen? We have fibers from the trigeminal coming to this nucleus for reflex lacrimation from the cornea and conjunctiva. Now, of course, it sends sensorimotor fibers to the lacrimal gland, but also to the submandibular and sublingual glands. So salivary glands, submandibular and sublingual, lacrimal. These are the parasympathetic cranial nerve, and this is cranial nerve 3 because they are related. I brought this to show you the 4 parasympathetic, because I want to finish with this also. I want to discuss them gradually. We mentioned the ciliary when we discussed the oculomotor. When the oculomotor from the Edinger Westphal, they accompany the oculomotor nerve, then they go to the ciliary, and from there, postganglionic fibers come out and rejoin through the short and long ciliary nerves to supply what? Oculomotor. The parasympathetic oculomotor. Superior. Levator malpulvis superioris. And constrictor pupilli and the ciliary. This is ciliary ganglion. See that? You know, try ciliary ganglion, postganglion. Then, this is cranial nerve 7. This is the one we are talking about now. 2. Pterygopalatine ganglion. This is new. This is first time to hear about it. And then the submandibular ganglion. Submandibular ganglion for the 2 salivary glands, sublingual and submandibular, and this for the lacrimal gland. So this is the facial nerve. Now, this we are going to discuss with the glossopharyngeal, the 4th parasympathetic ganglion. It's called the otic ganglion. This otic ganglion supplies the parotid gland. One ganglion, one parotid gland. So these are the 4 parasympathetic ganglion. One other important piece of information in this diagram, I told you earlier about it, we have something called the internal and external carotid plexus, sympathetic plexus, from the superior cervical ganglion. They accompany the plexus, and then from the plexuses they accompany all of these parasympathetic ganglia accompany, because they do not synapse, as you can see. Because they are already postganglionic fibers. So any sympathetic parasympathetic fiber going to a destination will take with it some sympathetic fibers. Sympathetic fibers generally accompany to the organs to supply the blood vessels of those organs. And if we have some glands that are stimulated by sympathetic fibers, glands. So they accompany to the glands and to the muscles of the blood vessels. So these blue fibers are sympathetic fibers. Now, the trunk of the nerve itself, by the way, when the trunk starts, there is a trunk of the nerve and there is an additional smaller trunk carrying the parasympathetic fibers. And it's called the nervus intermedius. It is like the accessory of the vagus. But this one is accessory to the facial. It's called the nervus intermedius. So the trunk itself emerges as 2 rootlets between the olive and the pear. Between the olive and the pear. And the pulse, sorry, olive and pulse. Olive and pulse. It's called the olivopontine junction. Olivopontine junction. There is a main motor trunk, and then we have the nervus intermedius with sensory and parasympathetic fibers. Sensory and parasympathetic fibers. But the main is the motor nerve. Now, it enters the facial canal. And now, before it enters the facial canal, how does it enter into the bone? Through which foramen? Internal acoustic meatus, together with the acoustic nerve of the auditory nerve of the vestibular. And I think I remember I mentioned that the vestibular part of the vestibular nerve is a very common site for schwannomas or acoustic neurons. When we have one, it will compress the nerve and then the patient comes with loss of equilibrium and facial symptoms and signs. So through the internal acoustic meatus, then from the internal acoustic meatus, it goes into the facial canal. Now, as it hooks in the canal, there is a geniculate ganglion. As it hooks, before it hooks, then it hooks, generating something called the genu. Genu means knee. So any bend in anatomy is called the genu. We have a genu of the internal capsule, the knee. The end of in a bend. Before the end, there is some ganglionic cells. What do you expect these ganglionic cells to be? What type of neuron and what is the nature of these neurons? The ganglionic cells, and they are found in the facial nerve, which is one of the mixed cranial nerves. Pseudo-unipolar. Because we mentioned it more than once. Pseudo-unipolar neurons are found in dorsal root ganglia and in ganglia of mixed cranial nerves. اللي هم ذكرنا التراجمينال نيرف وشوفنا التراجمينال جانجليون هكذا والآن facial it has got a geniculate ganglion. Later on we will see the glossopharyngeal and the facial and the vagal ganglion. So they have a geniculate ganglion which is sensitive. Then it turns and exits as through the sternomastoid form between the mastoid process and the silent process. This is just a summary. The 4 nuclei. Mating has ended. These are the 4 nuclei, and we have them give the nerve with different components, especially visceral afferent and general visceral afferent from the nucleus of the tractus solitarius, and then we have the parasympathetic one, the general visceral efferent for the salivary and lacrimal glands. And then we have this one, which is, this is motor nucleus of the trigeminal. Where are the other nuclei of the facial vagus? This is vagus, sorry, this is vagus. Why did we have this here? Okay, where is it? We're going to between the olive and the pons. What do we call the whole junction? Pontomedullary. But where about in the pontomedullary junction? Between the olive and the pons. So where is it? There it is. And it has got 2 roots. A larger motor one and a nervous intermedius for the parasympathetic and sensitive. Then it goes into through the internal acoustic meatus, and before it bends, it has got a geniculate ganglion, and then it continues in the facial canal and exits through stylomuscular. Now, 2 important pieces of information. This facial canal is very tight. There is no room around the nerve. So any inflammatory process leading to edema will compress the nerve. Yesterday when we discussed loss of blood to brain, we looked at any edema, any increase in the pressure will compress the neurons will lose their blood supply and they will degenerate. By the way, you know what vasa vasora are?
Yes. They supply
Blood vessels.
What are the blood vessels supplying the nervous tissue? Vasa nervosa. What are the nerves that supply blood vessels? Nerves. Nervi vasora. And what are the nerves supplying nerves? Nervi nervora. Vasa vasora or vasa nervora. Why am I mentioning this? Because of the vasa nervora. Small blood vessels supplying the nerve. When there is compression, these vasa nervora are blocked and the nerve or nervous tissue die. So then the nerve is often affected by viral infection or any inflammatory process, then it swells up, there is compression of the nerve, there is facial palsy. So this I needed to mention this because the canal is very tight, there is no room, there is no potential room around the nerve. Now the second piece of information, it starts giving its branches before it exits. So it has got a greater petrosal nerve. But let me pause for 1 second. This is these are parasympathetic fibers. And there we have, you remember this plexus? Internal carotid sympathetic plexus. We have a deep petrosal nerve. Deep petrosal nerve coming from the plexus. It's a sympathetic nerve. And there is a parasympathetic branch called the greater petrosal. This greater is often called the superficial petrosal. It has got two names. Greater petrosal and superficial petrosal. It is superficial because there is a deep petrosal. And it is greater because we have a lesser petrosal. So it relates to two nerves. Compared with this one, it is the superficial petrosal. So the superficial petrosal and the lesser petrosal join together to make something called the nerve of the pterygoid canal. Nerve of the pterygoid canal. It goes through the pterygoid canal to the pterygopalatine ganglion. And we just mentioned it. You see that? قلنا في حاجة اسمها pterygopalatine ganglion for postganglionic fibers to supply the salivary glands and salivary glands and خلاص صاحيين يعني أنا شاهد إنه نتكلم شوية فخلاص nerve of the pterygoid canal. It is a combination of sympathetic and parasympathetic fibers of the fascia. This is the geniculate ganglion, and this is again to show you the blood vessels around the very tight gland. And this is the geniculate ganglion. Now, we already covered the geniculate ganglion. It contains pseudounipolar neurons. It is for which type of sensation you expect? What sort of sensation we have in the facial? يعني somatic, visceral, facial nerve is mainly a facial nerve, but it's got general sensation and special sensation. خلينا نشوف.
Yes, through chondrotympani, it supplies special sensation for taste. Special,
yes, thank you very much. Well, nucleus is اسمها? The name of the nucleus on the inside? The name of the nucleus on the inside dealing with visceral sensation. What is the name of that nucleus? Nucleus of the tractus solitarius.
Yes.
It serves all visceral sensations, including the facial, the glossopharyngeal, and the as you said, the anterior 2/3 of the tongue, we have special sensation, taste. It's not just the tongue, also other places in the mouth. We taste through our palate, we taste through our cheeks, and so on. But all of that comes through the nerve, this facial nerve, from the nucleus of the tractus solitarius, and then through the neurons in the facial geniculate ganglion inside the facial canal. This one. Okay, most are gustatory for taste, conveying taste. Now, peripheral processes قلنا خلاص مش كده؟ in the second order neurons in the nucleus of the tractus solitary. Now, the peripheral ones pass to taste buds. How? You mentioned the chorda tympani. Can you tell me anything about this chorda tympani? It's a chord? Why is it tympani?
Because it goes through the money.
Yes, just near, in the middle ear near the tympanic membrane. So it leaves the facial nerve while it is still within the petrous bone. And then it goes through the middle ear, and then it joins what? How does it reach the tongue? It joins the lingual branch of the trigeminal. Because the lingual branch of the trigeminal nerve is going to supply general sensation for the anterior 2/3 of the tongue. So it takes with it the taste sensation of the facial, which comes to it through the chorda tympani. They go together. When they reach the tongue, this one supplies general somatic sensation, the other one supplies special sensation, which is the taste one. So the cutaneous neurons send central fibers to the spinal tract of the trachea. We finished with the visceral neurons. We have other neurons which are somatic. So the same geniculate ganglion has different types of neurons. Some of them are visceral for taste, and some of them are sensory for the skin, somatic sensation. So also central fibers to the spinal tract of the fifth cranium. مش كده؟ قلنا قبل شوية spinal trigeminal nucleus. We have the neuron in the ganglion. The central process goes to the spinal trigeminal. Peripheral go to the skin. Now, these fibers for the skin supply a small area of skin in and around and behind the ears. Here. Small area of the skin supplied by the facial nerve through this spinal trigeminal nucleus. Okay. Summary. This is the sensation. The taste one through these pseudounipolar neurons to the solitary nucleus, and then up to the thalamus to be sensed. The other is here, glottis or pharynx, ما قلنا ده كله taste. All of this is taste. طيب فدي موضوع التيست in relation to nucleus of the tractus solitary. Summary of the whole nerve. خلاص أربعة. This is the facial motor hooking around, making the colliculus and the floor of the fourth ventricle, the major root. عندنا another root which is the nervus intermedius. It brings fibers from the superior salivatory nucleus. They pass, they are not related to the ganglion, while from the tractus of the nucleus solitarius, or the nucleus of the tractus solitarius, and the spinal trigeminal nucleus through this pseudounipolar neuron, and then we have a nerve, motor and sensory nerve. Distribution. I'm not going to tell you about this. I think you already know. I've got five terminal branches, but remember others. This one, I just mentioned it, the greater petrosal nerve, and through the greater petrosal nerve to the pterygopalatine ganglion, then it supplies the lacrimal glands, and then the mucus glands in the nasal cavity and surrounding areas. These are supplied from the pterygopalatine ganglion of the fascia. Now we have taste buds, tongue and otherwise. And then we have the submandibular ganglion to the two glands. It also comes from the facial nerve, so the chorda tympani of the facial nerve. to the anterior two-thirds and submandibular. So this is motor and this is sensory through the chorda tympani to the mandibular division of the trigeminal nerve. Now there are two important branches. One of them is called the nerve to stapedius. It supplies a muscle called stapedius. What is the function of the stapedius muscle? It is attached to the stapes. Yeah. Stapes is one of the ossicles of the middle ear. And when the muscle contracts, it stabilizes the stapes. It prevents the stapes from over vibrating. It dampens the vibrations. And when there is paralysis of the facial nerve, this is lost. So once you hear anything, the loud is magnified. The sound is magnified. And it is called hyperacusis or hyperacusia. Hyperacusia is a sign of facial nerve paralysis because of this nerve. There is the posterior auricular, this one, and it carries skin sensation through the nerve, skin sensation. So these two nerves, before the facial nerve divides, and of course you know the chorda tympani, and you know the greater petrosal. So either it has got four nerves before it leaves and divides into five. Now, when it leaves, it goes through the substance of the parotid gland. Through the substance of the parotid. The parotid gland has got a deep and a superficial part. It passes between the deep and superficial part of the parotid. If we have problems in the parotid gland, then these branches will be compressed. But if the problem is in the parotid gland, then these are not affected. We do not have hyperacusia, we do not have dryness of the mouth because we do not lose taste sensation because these nerves leave the facial nerve before it enters the parotid gland. So this is a description of the distribution. We already mentioned it. I put the slide so that you go back to it and check it again. So this is the distribution of the nerve, and we are done. So خلاص, you go and study this. You know, I mentioned all of this while I was talking. The geniculate ganglion, superficial greater petrosal, I mentioned this, the nervopterygoid canal, enters the cranial cavity, the carotid canal, and it is met by the deep petrosal, and then goes to the pterygopalatine and the postganglionic through the zygomatic nerve to lacrimal gland and so on. I already mentioned all of that, but I am just documenting it here so that when you study, you have a look at this distribution. Now, this is an additional relationship because of this branch of the trigeminal nerve and going the chorda tympani and all these stories. I already mentioned all of that. We already saw this picture. So you please go through these slides to study the distribution of that nerve because I want to get to the final one, which is lesions. I already mentioned the lesion. Now, this is important. Your colleague mentioned it. This is the chorda tympani, very close to the tympanic membrane. If you have infection of the middle ear, as it is very common in children, you can have that nerve in particular damaged. This is the chorda tympani and the stapedius muscle. Chorda tympani, very specific. By the way, I already mentioned why we have facial palsy. Why do we have facial palsy? What is the main cause that we have?
There is a problem with the parotid gland.
No, if there's an infection or inflammation, then
Okay.
vas nervosa swell up and there's no space for the carotid surface.
Because the canal is very tight.
Yes.
This is the main reason. The canal is very tight. Any infection, any edema will compress the nerve, and the commonest cause are viral infection. Now, we could have supranuclear. Supranuclear means problems in the internal capsule or the cortex or whatever of areas supplying the face. And these, I think you know them. Where is the face area of the motor area? Is it up there or in the middle or down there near the lateral?
Near the lateral.
Near the lateral. Is it sulcus or fissure? It's another. Near the lateral fissure. Huh? This is, what about the face area or the head area, including the face, in the internal capsule? Where is it? Internal capsule. Is it in the anterior limb, in the genu, or the posterior? In the genu. In the genu. Head area, genu. Head area. If you have a problem there, all of these lead to supranuclear in the cortex or the tract. Or the tract. The tract means the fibers coming through the internal tract. Now, I want you to remember one thing. When it is supranuclear, remember I said the nucleus itself has got two parts, the upper part bilateral, the lower part contralateral. If you have a cortical or tract problem, then the upper half of the face will not be affected. And when you examine the patient, upper half of the face is gone. If it is supranuclear. If it is nuclear or facial nerve, trunk or branch, then the whole face will be affected. Is this clear? This distinction? If we have a cortical or subcortical but supranuclear, the upper half of the face will not be affected because the nucleus is supplied from the other cortex as well. So no problem, upper face. But lower face will be affected in the on the contralateral side.
Why only the face?
Because the nucleus receives cortical neurons from both sides, the upper part of the nucleus, or the part of the nucleus supplying the upper half of the face. So, if the damage is on one side, the other side will continue to supply the part of the nucleus supplying the upper half of the face.
So the lower part is only supplied by one?
Yes, contralateral. Now, the causes, sometimes there is a nuclear in the pons, there is a tumor in the pons, for example, leading to nuclear damage. And then we can have damage of the nerve intracranially. What will be the difference when we have intracranial damage or extracranial damage? Is the intranuclear what are the organs involved, and if it is outside the brain? I said there are 4 nerves that come out of the facial nerve before it exits. Do you remember them? Yes? The rosal, or the tympani, the retroposterior auricular, and nervus statics. If it is intracranial, then these might be affected. If it is extracranial, only the terminal divisions. So, nerve intracranially, like in the acoustic neuroma, and then nerve in the ear, اللي هو الأوتيتس ميديا زي ما قلنا أو tumor will affect the chorda tympani or the nerve itself. Herpes of the geniculate ganglion will ده اسمه رامزي هانت. رامزي هانت syndrome. You detect it clinically if you find some whitish vesicles on the ear. It's called Ramsay Hunt. Ramsay Hunt affects the geniculate ganglion. And then we have idiopathic. Idiopathic of unknown origin, and this is called Bell's palsy. It was described by Bell. So Ramsay Hunt, geniculate ganglion, or idiopathic edema in the canal or the foramen, and this is called Bell's palsy. And now you know the different types. This is what I was talking about. If it is cortex or the supranuclear lesion, on one side, the upper face will be normal, the lower face will be affected. This is the Ramsay Hunt syndrome, this whitish vesicle. The ear will tell you about Ramsay Hunt. Now, we already mentioned that and we are done. Up affect movement of the lower face contralateral. They are supranuclear, upper motor neuron lesions. While lower motor neuron lesions, all muscles are paralyzed, and also paralysis of the stapedius leading to hyperacusis. Yes. Okay.